Hi, I'm Raya from the COVID Recovery Initiative, and today I wanted to speak to you about the symptoms of COVID. Now, I know that you will be well aware of the symptoms that tell you that you should go get tested for the coronavirus. And these are things like flu-like symptoms. So our cough, our fever, our sore throat, shortness of breath, runny nose, fatigue, etc. So these are the most commonly reported symptoms medically and within the media. But recently, I've been doing a lot of research in regard to the coronavirus and the implications that it has on one's health. And there's actually up to and probably over 100 different symptoms that an individual can experience when they have COVID. And it's really important that we're aware of these and actually talk about them, because it's not as simple as getting a cough and a fever and a sore throat. It can actually be much bigger, much scarier, and much more debilitating. And this isn't to create fear, that's not my intention of this video, but it is to inform you that it isn't just as simple as, oh, I'll get COVID and I'll probably be okay. Yes, we do want to think the best, but we also want to be informed and educated enough as to how we better support ourselves during this time. And I know at the COVID Recovery Initiative, we specialise in post-viral fatigue or post-viral syndrome. So that has been our main focus, but we also want to talk to you about what you may experience during COVID and how you can better support yourself. So what's really important to know is that there are many symptoms. There is up to 100 or more symptoms that are normal or common within the coronavirus. And obviously we don't know a whole lot that we'd like to know, given that the research is only being developed now. But it is really important that we're aware of what might pop up or what we might deal with. And what's also really important to know is that we're going to, if experiencing coronavirus, you're likely to experience multiple symptoms. Now, there are patients who present with 30 to 50 symptoms across their experience of coronavirus. So we say that there's 100 and you go, oh, wow, that's really intimidating. It's also quite scary to know that you can experience multiple throughout the course of your experience with the virus itself. So these symptoms can be musculoskeletal, so they can be pain-based or body-based or whole body-based. They can be respiratory-based, cognitive-based, emotional health-based, neurological-based, cardiovascular-based, gastrointestinal-based or digestional-based. They can be hormone-based, immune-based. They can impact our senses. So they can be really across the board. So we know things like fatigue, muscle aches, shortness of breath, difficulty concentrating, headaches, persistent pain, can be digestion upset, can be difficulty sleeping or night sweats. We can see lots of joint pain or specific localized pain within the body. We can see memory problems, anxiety, sadness, personality change. We can see dizziness. We can see obviously coughing, we can see blood pressure changes going to higher or lower, or instability. We can see tachycardia, so an increase in heart rate. We can see fever and chills, but we can also see loss of smell and taste. We can also see phantom smells or taste, or just a change in the sensation. But we can also see hair loss, things like hormonal imbalances or feeling irritable. We can see exhaustion and very high rates of whole body fatigue. We can see an increase in sleeping, or we can see insomnia. We can see syncope, so fainting, and there's really a lot, and I'm not going to go into all 100 for obvious reasons, but other ones can be swelling in the hands or feet, can be an intolerance to heat, it can be chills but no fever, it can be rashes, it can be a change in skin, so dry or peeling skin, it can be swollen lymph nodes or elevated thyroid or anemia or other infections. So there is really almost every symptom that we could think of, we see quite commonly within coronavirus. And it's really important that we know that. And it's also really important to acknowledge that there are probably other comorbidities. We don't know each and every single circumstance. So an individual may have already been predisposed to some of those symptoms. So it's important to acknowledge that. But it's also important to acknowledge that the coronavirus is a huge challenge on our body's overall status and symptoms. And it's really important to take that into account, that it's not just a virus. We can't downplay this. We're seeing the rates globally skyrocket, or we've seen that, and hopefully we're seeing, flattening the curve to the best of our ability in some countries. But it's really important to keep in mind that the impact of COVID can be quite huge. And it's not just about looking at ideally prevention, definitely. And it's not just going, okay, well, I'm a healthy individual, I'll be fine. It's really important to acknowledge the impact that this may have on your life and on your future as well, as to what longer lasting effects that we don't quite know about just yet, because the research isn't there. So we can make assumptions, and it's kind of a good thing that we are, so that we're able to set up supportive strategies around that for prevention in the best possible way that we can. So I encourage you today to stay informed. And that doesn't mean that you watch the media all day, every day, but it's important that you're aware of your risk. It's important to be aware of the impact and the implications of COVID on an individual, and important not to downplay the situation, and to make sure that you're looking after yourself and others as best as you possibly can during this time, so that we're minimizing the risk, we're minimizing the impact, and we're minimizing the long-term implications that this will have on ourselves and as a society, on our healthcare system, on our healthcare professionals, everything. So it's really important that we're aware, that we know the facts, and that we take them into account when we're doing things, making sure that we do socially distance, making sure that we're trying to keep our immune health, or our overall health, as good as possible during this time, for obvious reasons. Okay, so I could go into it more. I'm very passionate about this area, but I've got to run. If you have any questions, please comment below, but I encourage you to share this with people. It's really important that we know more about the coronavirus, not just from a numbers perspective, but knowing from an impact perspective how we can better look after ourselves and others during this time. So I encourage you to share this video and help us get the message out.